and welcome. I'm Nicole Springer, Chief Equity Officer and Senior Director of Professional Development and Scholarship with Campus Compact. We are excited about our partnership with the Academy of Community Engagement Scholarship, an organization that recognizes exceptional leaders who live at the intersections of academics and communities to benefit society. Together, we bring to you this series on addressing wicked issues through community engaged scholarship. This year, we will focus on youth and gun violence, exploring the context, root causes, and how education can respond. Leading the charge is Campus Compact's Wicked Issues Fellow, Dr. Camille Williamson. So without further delay, I will hand this over to Dr. Williamson.
Thank you so much, Nicole, and thank you so much to Campus Compact and ACES. Happy to be here with you all this afternoon. So you might have noticed on the website where you registered to attend this webinar an article or maybe some blurbs that specifically talk about wicked problems. To emphasize this kickoff conversation, I just want to talk a little bit about what a wicked problem is. You might have heard this. If you are an academician, you might have heard this in some of the things that you're reading, or if you're a student, these are things that you might be learning about. The theory of wicked problems is a little bit over 50 years old, and basically it gives us a way to consider large scale problems as we're attempting to chip away at them, reduce them, or eliminate them. Wicked problems can be very difficult to define, not impossible, but challenging to define because of how big, broad sweeping, and impactful they can be to a number of different stakeholders. And you might have also noticed on the website that there are sort of 10 criteria specifically in which to think about wicked problems. So not only can they be challenging to define, they're obviously very challenging to solve, and it's not unusual for solutions to have unintended consequences, and it's also not unusual for solutions to be evolving, especially with the usage of data-driven decision making. So sometimes the solutions might be seen as good or bad, but no solution, not one sole solution, tends to solve a wicked problem. Hence, big, broad sweeping, and often requiring evolving solutions. Also, in terms of unintended consequences, it's not unusual for wicked problems to be connected to other problems. And I'm sure that will come out in this webinar series and perhaps even today. And sometimes there are consequences to employing certain solutions to address a wicked problem that may exacerbate other problems or perhaps even improve them. So I hope that everyone's sticking with me here and considering all of these different things as more of a lens in which to view wicked problems. It's not unusual for wicked problems to have more than one solution, hence solutions that are evolving. And they don't necessarily have an exhaustive list. I would challenge us all to think about solutions to wicked problems to be mm, more helpful in terms of how do we research the problem to clearly define it to better determine what the solutions or the list of solutions should be. And this does often require some political will. In addition to problems being wicked problems being connected to other problems, sometimes it can be considered to be a symptom of another problem. This also plays a role in how we define wicked problems and why it can be so challenging. And because there are many stakeholders who are involved, each group of stakeholders might have different ideas about how to define a wicked problem and what the solution should be. And different stakeholder groups are going to experience different levels of impact of a wicked problem. So, um, one other thing I would add to the list of 10 to emphasize of the list of 10 criteria is that it's not unusual for people who are in charge of or tasked with trying to solve wicked problems having some experiences. If the solutions that they're pushing forward are not helpful, it's not unusual for there to be a lot of pressure there. And so that might deter some of us from trying to solve them because if we don't do a good job, it might not be seen favorably upon that individual or groups of people who are trying to solve a wicked problem. So just with that little synopsis, you could understand what makes a wicked problem so wicked. Hard to define, hard to solve, very politically challenging, involves a lot of stakeholders, consensus building is challenging, unintended consequences, and connected to other problems. However, all those things may be true, but it's important to consider that since wicked problems tend to impact the vast majority of us, they require solutions and they require sustainable solutions. Hence, the importance of research and gathering data to make decisions about how to solve these problems. And so, to that end, solutions need to be thoughtful, holistic, and collaborative. Thoughtful in the sense of have we really clearly defined the problem and have we engaged all impacted stakeholders to help us understand how everyone sees the problem? And they do need to be holistic. So there isn't one thing that's going to solve this particular wicked problem, but there are probably several things. And lastly, they do need to be collaborative in that they should engage all impacted stakeholders. This is not unusual. And when we see particular ballot initiatives during election season, that is a part of trying to solve wicked problems or reduce or eradicate something that might be connected to a wicked problem. So, collaboration is key. One last point that I'll say about strategies to addressing wicked problems is the triple A strategy. One, awareness, to raise general awareness about the ubiquity of a wicked problem, meaning does everyone understand how they are impacted by this wicked problem? Because it's not unusual for some people to not know. Also, acceptance. So there has to be some clear acceptance that something is a problem in order for it to be solved. And so, in order to do that, there has to be a process in which we all grapple with the reality of a wicked problem in order to come together and access that thoughtful, holistic, collaborative approach to solving it. And lastly, adaptation. And not necessarily adapting to a problem and allowing it to exist, but thinking collectively about innovative solutions. And so sometimes, in accordance with things, with solutions having to be more evolving, this is where the adaptability can come into place. So I wanted to provide that brief overview of a wicked problem and encourage us all to use that theory and those concepts as a lens to explore youth and gun violence. Joining us today are Dr. Kim Joseph and Penny Okamoto, and they will be talking to us today specifically about their experiences in learning about and addressing the wicked problem of youth and gun violence. I would like to share with you their bios, and then we're going to move into some brief stats that Penny will provide us with, and then we'll move into some questions. And I encourage everyone to put their questions in the chat after the panelists have moved through these preliminary discussion questions. We'll be able to take participant questions closer to the end. So, Dr. Kim Joseph is a retired surgeon who is the division chair for trauma critical care and prevention in the Department of Trauma and Burns of the John H. Stroger Cook County Hospital in Chicago. She has had an interest in injury and violence prevention throughout her career and served as the medical liaison for the Hospital Crisis Intervention Project, the Stroger subsidiary of Connections for Abused Women and Their Children, which provides domestic and intimate partner violence counseling and support for individuals and families. She also worked closely with Healing Hurt People in Chicago, the hospital based violence intervention program based at Stroger and Comer Children's Hospital. In addition to her work at Stroger, she is a past chair of the Chicago Committee on Trauma, working on their education, advocacy, and prevention initiatives. She is a past chair of the Patient Family Support Committee of the Society of Critical Care Medicine, and in 2009, she became the first woman to chair the surgical section of the National Medical Association. And in retirement, she has focused primarily on her work with the SSNMA, as well as with the Advanced Trauma Life Support Program of the Committee on Trauma of the American College of Surgeons. Welcome, Dr. Kim Joseph.
For having
And
me.
we are, thank you so much. And we also have Penny Okamoto with us. Penny Okamoto has been working to reduce gun violence since 1999. She began her work in gun violence prevention as the coordinator of Volunteers for the Million Mile March in Oregon. She joined the Ceasefire Oregon Board of Directors in 2000, where she was the executive director from 2010 to 2021. Currently, she is the executive director of Ceasefire Oregon Education Foundation. Her work with Ceasefire Oregon Education Foundation includes policy development and research. Ms. Okamoto co-authored Ceasefire Oregon's plan to reduce gun violence, the Firearm Injury Prevention Bureau, and the Ceasefire Oregon Education Foundation presentation, comparing rate, lethality, and injuries of mass shootings in OECD countries who ban or permit military-style firearms for the Oregon Public Health Association conference. She also has been published in The Guardian and interviewed on numerous local news shows and Al Jazeera. Welcome, Penny. We are excited to have you here with us as well.
Thank you.
And that is a great transition to hear about some specific statistics that we should be considering as we begin our discussion on youth and gun violence.
So, according to the Gun Violence Archive, which is really the leading source for information on gun violence prevention in the United States, as of yesterday, for 2024, 15,782 people have been fatally shot through means of homicide, unintentional shooting, law enforcement. That does not include suicide. So it's almost 16,000 people. In fact, today, tomorrow, this week, it probably will end up being 16,000 people so far just in 2024. As of yesterday as well, 30,096 people have been injured by firearms. We don't know the number of people who have used a firearm to kill themselves this year so far. Unfortunately and shockingly, that data lags usually by a couple of years. It's estimated to be probably 25,000 people, though. So we've got 16,000 people so far who have been fatally shot. We've got probably 22,000 right now, approximately, who have used a firearm to kill themselves, and we've got 30,000 people who have been injured. And one of the reasons Gun Violence Archive is so important is because while any injury that comes into a hospital has to be reported, not all law enforcement agencies are required to report data to the FBI or to anyone regarding firearm injuries. And we need to say right off, I'm sorry, need to say right off, gunshot is the leading cause of death for kids and teens in the United States. More than cancers, more than car crashes, it's gunshot death. Thank you.
Thank you so much for sharing those statistics. And I know a lot of us may not be as aware, but can you also share if the numbers are trending up or trending down?
So we know that they were trending up in the during the pandemic, and it kind of depends on what you're looking at. We're hoping that by the end of this year, it's going to be trending down a bit, but but it's still above pre-pandemic levels.
Thank you. And so I know that you shared this a little bit in your bio, but can you share a little bit more about your background and how you first became aware of this problem of youth and gun violence and anything that was shocking to you, Penny?
So I really became active in this in 1999. Would have been after the Columbine shooting. After the Columbine shooting, a lot of people were like me saying, "Oh, government's definitely going to do something now about it," and of course they didn't.
Mhm.
As a matter of fact, the NRA came into Colorado shortly after that and had a big party. They had their, I don't know, big event, whatever meeting that they have there. It was a real slap in the face. And then shortly after that, a 5-year-old girl, Kyla Rowland in Michigan, was fatally shot. Another student found his uncle's gun at his mother's house, took the gun into school and shot her to death. And I'm thinking, what's going on here? My background is, biological research, and so I started to take a look into it. And I think the thing that was most shocking is I thought, oh, if only people knew how guns really aren't making us safer. How this is really about making money for the firearms industry. I thought people would be more interested in taking action, but they're not. So I think the most shocking thing is the unwillingness of legislators to take action.
Mm,
Um, that's probably the most shocking thing overall. But then I think you kind of said everything else in my biography about what I've done since then.
mm. Thank you.
Thank
And
you.
Dr. Joseph, can you tell us how you first became aware of this problem of youth and gun violence and what shocked you?
Please call me Kim. So I practiced for about 25, 30 years in Chicago before I
Mm,
retired. My first awareness actually of young people in connection with guns was when I was a child, really. I grew up sort of at the tail end of the Vietnam War, and so was exposed to a lot of information on television and from people who were only really a few years older than I, um, having to go to war, and they were young. They were all young. And I first really became aware of guns. My father was a hunter. He hunted with both long barreled weapons as well as bows and arrows, but specifically uh, shooting at animals, obviously.
mm,
And the first I can remember the idea of human beings shooting at each other really was in connection with the Vietnam War. And I would say that's the first time I was shocked by the notion that people would shoot at each other. Um, so and I was obviously quite young. The first time I became really professionally aware of it was when I started in the trauma unit. And this was a particularly difficult time in Chicago. It was in the late 80s, early 90s. There were, for a variety of reasons, there was an uptick in firearm violence and a lot of very, very young children who were being shot fatally. Penny's information about, it's our kids who are dying, and also the lack of data we have on suicides, which has been a chronic problem. The chief agency that was able to document firearm injuries and deaths in Chicago during that period of time was the Chicago Tribune. That's where people were getting their information.
mhm,
Because, as Penny said, there is this disconnect that continues to exist between what we see in healthcare and what law enforcement sees and how that's reported and how that's linked. I think that still exists. It certainly did at the time of my retirement. And that I also found shocking at the time, in addition to seeing, children. And I'm not talking children the way that I think of children, anyone under 18 really is a child. We're
mhm,
talking 7-year-olds, we're talking 5-year-olds who were being shot. And I felt the same way that Penny did, is that, well, okay, this is happening now, someone's going to do something about it. And people did try to do something about it. I don't want to take away from all of the people who really did try to advocate and to change legislation. And in Cook County, there was a successful, at least again, when I retired, still a successful assault weapon ban, for example, even after the federal ban was lifted. So I don't want to take away from that, but those are the things I remember being shocked about, that this was happening. And then really throughout my career, I think one of the things that people don't understand about this is the impact that non-fatal shooting has on individuals, on their families, on their communities, how witnessing violence, the impact that that has on individuals and families and communities. And when we look at something that I think I certainly wasn't trained in it outside of my previous background in school and social work, but what's become known as adverse childhood events, ACEs. And this notion that just witnessing, or even some people say just hearing about chronic violence taking place in your community has an impact not only on your mental health, it has an impact on your physical health. That has now become what many people would consider an adverse childhood experience. That's shocking. So there are any number of aspects to this problem that are shocking. And the fact that we don't seem to be able to reach a consensus on how to approach it, or to approach it at all sometimes, is shocking. And Penny had mentioned the issue with suicide. We've known for years and years, at least during the time that I was in practice, that as bad as the situation was for homicide, it was worse nationally for suicide. And I remember again being shocked that, okay, I understand people think of the homicide stuff as other. That doesn't happen in our neighborhood. That doesn't happen in our place. Even after seeing, multiple incidences of mass shootings, it's happening to other people. Suicide is something that I always thought we could gather people around, that if we were able to say to you, this is a problem, your teenager who is depressed, your grandmother who is depressed, if they have a firearm available to them, the chances that they are going to successfully complete a suicide increases significantly. So I always had thought maybe that's something we could gather people around to look at advocacy and look at engagement. And I wasn't able to do it, certainly, but I still have hope. But so several aspects of this have shocked me over the years.
Mhm.
So
Thank you all for sharing your thoughts. And as you can see, there are lots of layers to this problem, from people seeing it as something that's happening, but maybe it doesn't really affect them. Problems with collecting data and being able to determine trends to create some sort of solution, and not necessarily only at the intervention level where somebody might end up in a trauma unit, but at the legislature level, which is what we're all, I would say, has been quite shocking considering the enormity of the problem, and who is most impacted tends to be young people. So just to continue to think about youth and gun violence, and let's start with you, Penny. What do you think causes this problem?
So I'm actually going to go back for a minute to Charles Dickens' Christmas Carol, appropriate for the time of year. And some people kind of don't really they kind of miss this part about A Christmas Carol, but in one part that goes to Christmas present, reveals beneath his cloak two children, ignorance and avarice, greed and want, right? And I think, we have that, unfortunately. Every society has that. Uh, and the ignorance really, people might think I'm saying that, people who are committing crimes with firearms, are greedy and ignorant. That's not really what I'm saying. Um, there are two things really that I really want to say about this. One is that we aren't going to cure people who are going to have violent tendencies. I mean, we're not ever going to get rid of it entirely in humanity. I hope so. I would love to be wrong about that. But I don't think that's what we're going to do. We can, however, work to make sure that people who harbor hateful thoughts or thoughts of harming self or others aren't armed with the most deadly weapons they can get their hands on. That's one of the things that we could do. But really, the ignorance and avarice really goes to what I think is the number one problem of gun violence in the United States, and that's really the greed of the gun industry. I think people are sometimes surprised to hear me say that, but it's true because in the United States, the National Sports Shooting Foundation, the Safari Club International, the National Rifle Association, um, they're all about selling their products. And their products are firearms, ammunition, classes, and things like that too. But mostly 70% of what they sell is ammunition and firearms. 70% of their profit comes from that, excuse me. So, and they can't sell those firearms anywhere else in the world the way they can here. So if they lose their market here, they're going to crash and burn. They saw what happened to the cigarette industry when the cigarette industry was finally held accountable, especially accountable financially. And that really was a financial blow to the cigarette industry. But tobacco went elsewhere. Tobacco went to other countries. Arms dealers aren't going to be able really to go to other countries a little bit, but not like tobacco did. So it's really the greed of the arms dealers that really is arming people who really should not be armed in the United States and perpetrating the myth that guns make us safer. Just a kind of a 30,000 foot view. We have about 333 million people in the United States. We have an estimated 400 million firearms. So more firearms than people in the United States. Hey, you know, if guns made us safer, we'd be the safest country in the world. And that is not the case. Guns are the leading cause of kids' death in the United States. 92% of all women in OECD countries who are fatally shot in the United States. No, this simply does not bear out. So that's kind of my overview on that. If I could address quickly Kim's comment about suicide, I would have to say I agree. That was one of the most shocking things. Over the past 25 years, I thought people would really rally around suicide prevention. People only rally around suicide prevention for veterans, actually. Anyone else, they kind of think, well, it's their choice. But that's really not the truth. Suicide can be prevented. Harvard has something called Means Matter that really explains that. I encourage people to go to that site. But we really need to work on the fact that suicide actually can be prevented. And if this were something else, diabetes or things like that, we would make sure people got help. So we need to make sure that people who have thoughts of suicide get the help they need and save their lives.
Thank you for that. And I appreciate you highlighting again how there might be some obscurity in terms of how people are viewing suicide and suicide prevention, and also uplifting that there are more guns than people in the United States.
A lot more.
Dr. Joseph, what do you think causes this problem?
You also alluded to it when you were talking about sort of the nature of a wicked problem. And I will admit right up front, I'm a novice to this concept. This was not something that I was really well versed in. But the notion that a complex problem has one solution and that one solution is going to fit everywhere is probably naive. But I do think the public health model, and it goes back to something that Penny was saying, is the prevalence of guns, and people don't like to hear that. But we talk in healthcare a lot about access, and when I've given press conferences years and years ago about this issue, trying to liken the gun violence issue to any other public health issue that we would look at. I tend to think medically. So I think in terms of infectious disease and things like that. And I used to say that guns are the vector for this problem in the same way that a mosquito might be the vector for something like the West Nile virus or some other kind of mosquito-borne illness, and that it would be a mistake to ignore this vector by thinking that, well, it's just, we don't have to deal with that. It really, the problem is how people think and that people are naturally violent, and there are absolutely other causes aside from the access to firearms. I agree 100% with Penny. In every other country that has the means to potentially afford the kind of firearm culture that we have in this country, they don't. That's not their culture. It is something that appears to be unique to our culture. in the United States when talking about comparable economies and comparable countries. So that is something that we need to explore honestly. I think the greed, the economics of it are important, but there have been other economic issues where we have made the decision that the public health outweighed whatever the economic issue was. And you know, we talk about these wicked problems. I do think there are issues of not just economics in terms of greed, but economics in terms of poverty, in terms of access to knowledge, and in terms of there's also an economics not just at the firearm manufacturer level, but at the local level where it makes sense for someone in their perspective to have a firearm, whether they believe that it keeps them safe. And I have very good friends who believe that that firearms keep them safe. And that's going to be a hard switch to throw because they truly do believe that. However, can we convince those people that there are situations in which maybe you either don't need the firearm, or if you are going to have a firearm, that there should be more protections to make sure that someone in your family doesn't get hurt by this firearm that you think is going to make you safe. So I do think we have to explore all of those aspects if we're going to look at a public health solution. One of the things I also wanted to just bring up in terms of causes, or looking at this as a wicked problem, which again is a somewhat newer concept to me, we do have a history of being able to solve, at least for a time, some very complex problems. And again, I'm going to go back to a medical background. It happens when we have the societal, political, yes, but also the societal will to say this is a bad enough problem that we are going to address it, and if necessary, legislate it out of existence. And the one that comes to mind based on mine and my father's background was a microbiologist. Smallpox has basically been eradicated in my lifetime. Now, is it completely eradicated? Of course not. But for all intents and purposes, there's nowhere that you go in the world where this is a problem that you really have to worry about. And this, if even 300 years ago, this was a disease that would kill millions of people. At some point in time, there was a decision made that you were going to mandate vaccines. And there's going to be monitoring all of the resources that were necessary to make that happen. It happened just before, or when I was a very young child, with polio as well. And we see that when we have that kind of societal will, we can take some wicked problems, I'm not going to say all of them, take some wicked problems and make them simpler, less wicked. But it does take that societal will. And so I think we know that it can be done. Part of the issue with convincing people to become engaged is that they look at the breadth of the problem and they say there's nothing that can be done about it. We have history that shows us that we can succeed. We also have history that shows us that we fail. And the other, infectious disease that I think of in that sense is malaria, because we have not had a global societal will to say we're going to get rid of this. And that is political. And it goes back to a lot of what Penny was saying. That is political. That a lot of that is. And for the people who are out there saying, well, but malaria is caused by a different type of microorganism, that isn't really the point. The point is that there are enough smart people out there that if we had decided 70 years ago that we were going to attack this the same way that we attacked smallpox and polio, that I think the outcomes right now would be different. So it does come back to economics, as Penny correctly pointed out. I hate to say it, but if you don't want to say racism, ethnicism, or certainly bias, against certain groups of people, and this sense of otherness, that this is a problem that happens to other people, so I don't need to be worried about it. But if we can help people understand that this is something that can happen to anyone, that it's not just confined to particular groups of people, then I think goes a long way to helping people, and helps us also understand the causes. The other thing I would say is that there have been times over at least my professional lifetime where the death rate and the incidence of gun violence has gone down. Another data point that we're missing is, why does that happen? So we can look at what happened. You had mentioned the pandemic. I don't know that we know, it's too recent for us to really know for sure why gun violence skyrocketed really during the pandemic. We need to look into that, but we also need to look into those periods of time where we start to see a decrease. Why does that happen? To really understand the causes. Why do we have these periods of time where things seem to be getting better? And maybe to figure out how to capitalize on that. What is that? So I do think we have a dearth of data that helps us understand the causes of this. I agree that access to firearms and the economic impetus that manufacturers have to continue to sell their product and to not improve any safety parameters around their product, which is a new thing. If you look historically, there have been times in the distant past where some manufacturers, actually, it was hard if you were not a very strong person to squeeze a trigger, for example. That they had guns, and it was designed specifically so that a child or a person who was not very strong would be able to squeeze a trigger. That's not economically important now. So how do we make that important? How can we convince the manufacturers that it actually is important to do that? So I'm rambling a little bit, but I think that what I want to get at is that I don't think there's one cause. I do agree entirely. I tend to have the same bias that you do, Penny, that it's about the access to the guns. That's my gut bias. It really, truly is. But when I do take a step back, I have to acknowledge that there are other places where the same access could exist, and it doesn't because the culture is different. So we do have to look at what it is about culture in the United States and our love affair with firearms that makes us ignore the profound impact that they have on life and death. And then I'll stop for a second.
No, I really
I would like to.
appreciate everything you said, and I'll get to you in 1 second, Penny. I think it's important for us to explore this. What is the culture? Why do we have this culture in the United States where there really is a love affair of guns, and if so much that it's a law that you have the right to bear arms, and also what happens when there are any attempts to limit access or change the way in which guns are manufactured to try to make them a little safer. I think we should talk about this part of our culture as one of the root causes. Did you have anything to add as we continue to explore this question about gun culture in the United States, Penny?
I do actually. I actually, in my preparation for this, I really have 6 root causes of gun violence. The number one is greed. The second is the malignant marketing campaigns. Marketing to young men in particular, how you're not a man if you don't have a firearm. Bushmaster actually used the advertising like your man card is reissued if you buy a firearm. And Bushmaster was successfully sued by the Sandy Hook families led by Josh Koskoff. And they were sued based on this marketing campaign. I'll get to why they were sued based on marketing in a minute. So the malignant marketing campaign of you need a gun to protect yourself, when people in the industry know that's not true. That's simply not true. Firearms, people say guns don't kill people, people kill people. If you really believe that, then the corollary would be that guns don't protect people, people protect people. So there's a malignant marketing. There's the complicity of the legislators. People don't like when I use that word, but it is true. If it's the #1 killer of kids in the United States, why aren't we doing more about this? We saw something similar to this in the 1980s when Ronald Reagan refused to talk about AIDS, and look how many people died. And this is what we're putting on our kids now already. It's not the future they face, it's their present, it's their reality, it's their lived experience. The other thing is Citizens United, the decision from 2010 that basically said, hey, money is speech, so you can give as much money as you want. That allows even everyone to be bought. And it devastates the laws that we have that actually will protect citizens. Another is the immunity for arms dealers. In 2005, the Senate, led by Senator Lindsey Graham, passed the Protection of Legal Commerce in Arms Act, which makes it very difficult to sue arms dealers, which is why the Sandy Hook families sued based on marketing, because that wasn't included in the Protection of Legal Commerce in Arms Act, also called PLACA. That's why Sandy and Lonnie Phillips, I worked with them as Survivors Empowered, they tried to sue when their daughter, Jessie, 24 years old, was fatally shot along with 11 other people, dozens of other people who were horrifically injured in that. They tried to sue the manufacturer, excuse me, they tried to sue Lucky Gunner, who was the seller of the 4,000 rounds of ammunition that the seller bought. And they were turned back because of Colorado's PLACA law, gun industry immunity law, which has now since been repealed. And not only could they not get justice, and all they were doing was to change how the ammunition is sold. They weren't seeking damages, but they ended up having to pay $203,000 to the people who sold the bullets that killed their daughter because of the gun industry immunity laws. Now, a Lucky Gunner also went on to sell the gun that was used in the Santa Fe high school shooting. And now the guy who owns Lucky Gunner sits on the Board of Education in the state of Tennessee. Okay, so if we had immunity laws, justice laws, maybe we wouldn't have the shootings that we have. We would have better practices, better products. And then also incredibly lax firearms laws and the refusal of shirking sheriffs to enforce those laws. So we've got greed, we got malignant marketing, complicity of legislators, Citizens United, immunity for arms dealers, lax firearms laws. And that's just kind of a broad overview. That's not everything. It's not comprehensive. So when we talk about a wicked problem, here you are. This is a hydra, many heads.
And I appreciate you framing it that way, because it does help us to understand why it's a wicked problem. There's so many things that incentivize this problem to continue to grow by lack of oversight, lack of restriction, increased access, unnecessary access, a dangerous level of access. And to that end, how would you say, and maybe just let's continue with you, Penny, how would you say the culture that we have here in the United States lends to that? Why do we have such a love affair with guns?
Really, it's the marketing, and it's the very successful use by right wings to say, hey, they're going to come after your guns, they're going to come after you. Just really based on this fear of other. No matter what your other is, whether your other is somebody who's from another country, who's a different color, whether your other is a woman. I mean, the women who are fatally shot in domestic violence, the women who are intimidated, all the people, the kids who are intimidated. We don't even talk about kids who are intimidated in their own homes with firearms. And it happens. That's one of the things that I would recommend that people who are interested in this research is intimidation, how firearms are used to intimidate family members. Who it used to intimidate, the public at large. Even we already know how it's used to intimidate people who want to vote. And we don't even have a definition for what intimidation is. For example, let's say two people are, sitting at the kitchen table and they're kind of having an argument, and one person brings out a firearm and lays it on the table. Is that intimidation? Could be. But so we need to look into that much more. So really, to get back to your question, It really has to do with um, good messaging on the part of the arms dealers, and frankly, not very good messaging on the part of people who are working to prevent gun violence.
Do you have thoughts about that as well, Kim?
I agree 100%. I think that the people who are trying to sell firearms and guns have done a much better job of selling the fear, um, than we have as, and I'll just say as healthcare advocates, of making people aware of our perspective. And not to say that we haven't done things, we certainly have. And I have friends who have done just amazing work in this area. And I think, we look at the Bloomberg School of Public Health and the wonderful work that they've done. There are people out there who are doing wonderful things. We're being outspent, and it's easier to sell fear. It's not just the gun manufacturers. I mean, even the people who are selling us things that are much more benign, like security systems and various things like that. I mean, that marketing is all about fear. It's about every 3 seconds someone's going to break into someone's house, and therefore you need all of these things in order to keep yourself safe. And I'm not judging that in any way. I'm just commenting that it is very easy to market to fear. It's much harder to get people to look in a nuanced way at what they're being sold. So yeah, I agree with what Penny has said. It is all about marketing to fear. And that leads to that sort of misinformation that you are going to be safer, or to be precise, that there's no downside to you having a loaded gun in your house with your children also in the house, that there's no downside to it, that this is going to protect you. Absolutely. Those of us who work, as Penny does, as you do, Camille, and as I did in the field, we know, because we watched it happen, where these unintentional shootings take place, where children shoot each other, where someone shoots a family member who they didn't realize was coming home late. There are any number of instances where we know that line of thought doesn't play out. How do we? The question, of course, is what's an effective alternative message? And I will admit, I have been struggling with that for a long time. As we had said before, I thought talking to people about suicide, that would be something where, how could you possibly blame someone who is going through such a mental health struggle, that you can't understand that this is somebody who should be protected. This is someone who should be protected from what is happening, and that if as Penny said, suicide can be prevented, someone like that should not have access to a firearm, someone who's going through such a profound struggle. And it has been remarkably difficult to I do not feel that I was ever able to message that effectively. So I agree with Penny. I think there's this marketing and misinformation that comes with trying to sell fear that that is a big part of this.
Mhm. So you both have touched on the impact of misinformation towards the general public. Do you think that there are some particular disinformation tactics that are being used with the public as well? Because we see this playing out in a lot of areas of our political processes where, all of a sudden people realize they don't know what a tariff is. So I'm just curious about your thoughts on how disinformation plays a role. Penny, would you like to start?
Yes. Devin Hughes of GBpedia, he wrote something called the fire hose of falsehoods, and it really just lays to waste the arms dealers, and how they market firearms, and not only how they market firearms. But let's take a little bit of a broader look. Some of us remember Love Canal from New York. Yes, so you're nodding. So Love Canal, for people who don't know, was a nice, cute little community. Found out it was built on a toxic chemical waste dump, basically. A lot of people, a lot of kids, people got sick, people died. When they found out it was built on a waste dump, they actually sued some of the chemical manufacturers. And to this day, chemical manufacturers have to pay into what's called a super fund to help clean up these sites. Okay. And we need something like that for firearms, because you take a look at the cost of firearms. We're just taking a look at just the financial cost, okay, of when you go out to a place and it's a place for, let's say, an outdoor shooting range, you know, it's full of lead, okay? Let's take a look at all the school shootings. Who pays for the recovery of that? Who pays when Sandy Hook School has to get taken down? Who pays when Parkland has to get taken down and rebuilt? We do have some generous donors, but mostly it's the taxpayer, okay? When people come in, and Kim could address this far better than I can, who pays, excuse me, the Medicare, the Medicaid? Taxpayers pay all that. Who pays when there's a crime committed with a firearm? Taxpayers do, because we send the police, we investigate, we put people in jail. The taxpayer covers all of that expense for the firearms. And the NRA doesn't care. They don't even send thoughts and prayers. You know, they just use it as another opportunity to sell more guns. Okay. So that's a different way we can look at this and how much firearms are just costing taxpayers. Again, it's another reason why the firearm industry wants to say, hey, this is your right. And you can do this, but don't ask us to like pay for it or cover it at all. We're not going to do that. And they've been extremely successful at that over the years. And it's wrong, 100% wrong. So
Yeah.
I don't know if that helps to answer the question or not. The other thing too is that gun violence prevention and laws, they are not controversial. We know that vast majority, for example, for universal background checks, which means a background check for all sales or transfers, including private sales or transfers. Brady Act covers federally licensed firearms dealers, doesn't cover private sales. That's overwhelmingly popular. Like 80% of Americans in general, gun owners, non-gun owners, NRA members, okay? If it's incredibly popular, so why isn't it already the law? I want to say that I've been doing this 25 years. I've seen how hard it is to get bills passed. And I've seen what the incredible things that people do to get laws passed. And I give President Biden a lot of credit for passing the Bipartisan Safer Communities Act. It wasn't a lot. It wasn't what we needed after the Uvalde massacre, but he got it done somehow. Okay. So there have been people working incredibly hard on messaging, on laws for years, for decades, and I applaud them. They've done great. But it's time for us to go to the legislature and say, this is not enough.
Yeah, I want to talk a little bit about the healthcare cost in a second, but just to go back to what Penny was saying about the support for some ubiquitous things that could be done, I think has borne itself out over and over and over again. Background checks. The American College of Surgeons has a work group that has been working with members of the college who are firearm owners as well as those who are not. And that also came up, and overwhelmingly people would support background checks for people who are purchasing firearms because it doesn't violate the rights of, quote, legal firearm owners. There are definitely some things that you would think would be very easy to get past. And that's where I do believe Penny is absolutely right. The greed really comes in, because if you're going to lose millions of dollars of donations to your campaign from this very powerful lobbying group, even if all of your constituents are telling you, yeah, I'm fine with background checks, go ahead. But, you know, this group is telling you, no, absolutely not. This can't happen. That's where that sort of dissonance comes in. But I also want to, in terms of people really understanding what the cost is, and yes, it is borne by the taxpayers, even whether you are in an affluent area of the country or an area that is supported, where most of your patients are on government type insurance. It costs more to take care of a firearm violence survivor at least again, when I was in practice, it costs more to take care of a firearm violence survivor than it does to take care of the average motor vehicle crash survivor. And we did studies at county, and people did studies at different places that documented that. Um, just in terms of pure cost. But the other thing that Penny talked about that I think is important is the cost of recovery. When you are traumatized, we talk a lot in the hospital-based violence intervention sphere about the notions of recidivism and whether or not something is likely to happen to you again. When you are traumatized, that does increase the chance that you will be traumatized again. And dealing with that up front is the most efficient way, but it means resources. It means people who are qualified to help you and to make sure that your care is coordinated better. Now, I do think that a lot of the focus now on social drivers of health is going to help with that, but we have to educate our healthcare providers. This was something that I would imagine, certainly nothing I was taught in medical school. I knew something about it because, again, I went to school really to study social work. But, these types of issues and care coordination and understanding the social aspects of healthcare, that's not something that was routinely taught. So we have a gap not only in just the strict financial part of it, but in the education and in helping the people who will be providing this care understand what's involved, and in helping them deal with what happens to them when they are repeatedly asked to care for people who are victims of violence. Whether it's from firearms or otherwise, but certainly from firearms, and to see really the devastation that it has, that has vicarious trauma and secondary trauma for people who are caregivers, and that costs. So yeah, it's an expensive problem, and we haven't done a very good job of marketing. There was a period of time a few years ago during the pandemic where some people from the NRA were sent something out on social media telling physicians, trauma physicians in particular, to stay in their lane. And some of my friends who are much better on social media than I will ever be shot right back, and shot's the wrong word, but went right back on social media showing, what it's like in the operating room, and, blood on the floor, and saying basically, this is our lane. And it gets back to this notion that we have to stop thinking of this as an other problem. This is our problem. This is all of our problem. And we have to figure out a way to convince people of that it really is our problem. Yeah.
Thank you so much for sharing that. I want to cap our discussion here so that we can get some questions from people who have joined us. But before we do that, I'd like to hear from the both of you. What are some of the main takeaways that you think participants in today's webinar should consider in reference to this problem and how to understand it? Penny, would you like to start?
Sure. I have notes. As you might imagine, I've been thinking about this. I've been thinking about this a long time. And for 25 years. Okay. My husband has been thinking about it as well. We have a lot of ideas. And I don't really, I don't think we really have the time to go through in detail a lot of these ideas. I really do think we need to research, and I believe that campuses are the best place to research the concept of intimidation, firearms intimidation. Intimidation at gunpoint. We need to define intimidation. Where does intimidation occur? So that's just one concept. We could really go into that. I'm just going to set this aside for a minute. Okay. Also, creating a preprint site. And again, universities are going to be great at this. Create a preprint site like we have bioarchive or some of the archives. I'm sure that Dr. Jolts is very familiar with this, but for gun violence prevention, because the data lags so terribly, and advocates and activists really need this. Also, particularly examining the role of firearm violence and gun violence in and near the community, and creating a campus score. How safe is your community, really? Okay, creating a campus score. How safe is it? One of the interesting things, like, well, anyway, I'm going to. There's just too much. And then also one of the things that I would be really excited to be part of, and again, there are a lot of things we're talking about. We're really excited to be part of is taking a page from the ACT UP folks. Now, a lot of people probably don't, they're too young to remember ACT UP, but ACT UP stood for the AIDS Coalition to Unleash Power. And they were so angry that AIDS was getting ignored in the 80s. Okay. And I feel this way. I am not a college age. I feel this way. Number one cause of death for kids and teens in the United States. Everybody should be talking about it every day. It should be like in the top 3 of every single community leader's concerns. And I say top 3 because, like, for example, in Portland, Oregon, the houselessness crisis is horrific. That needs, that needs to be addressed. Okay, I get that. I do. Climate change, I get that. But it's got to be within the top 3. We always have to be talking to people. Why are you talking about this? Number one killer of our kids. Why are you just letting it to get a pass? Okay, so take a page from ACT UP. That would be incredible. Working with community leaders and organizations to increase awareness of intervention programs like extreme risk protection orders that temporarily remove firearms from people who are going through a crisis, or suicide prevention. Reframing how we think about suicide, reframing how we think about firearms. For example, in the alcohol industry, we've got this great campaign that I've seen out called Rethink the Drink. Do you need to have a drink when you're at the laundromat? Do you need to have a drink at a baby shower? That's someone's personal choice or things like that, but we need to rethink that. Okay. And also recent information that has come out showing that no amount of alcohol is good for you. Not saying you shouldn't have a drink. That's not at all what I'm saying, but people need to be aware that there's no amount of alcohol that is healthy, which is something that we in the health industry, healthcare, we had thought previously that maybe, it was Veritol, whatever, was helping people. It's not. Okay. No guns in the home are healthy for you. No guns in the home, it's really true. You get a firearm in the home, you're greatly increasing the risk that someone's going to be harming self or others. So again, with the whole campaign, and I don't want to take up too much time, but I just want to say this one more thing. And people are saying, like, oh my gosh, this is just a terrible time to do anything. How are we going to get anything passed? Okay, but what we must do has to be done now, and I think maybe it can only be done now. Okay, now it's got to be done. This is the time of the ascension of autocracy and the decline of democracy. So right now is the time to dismantle this ossified, clanking claims of patriarchy. We need to dress ourselves in the transparent garment of naked truth. We need to allow our thoughts and actions to shimmer in the truth. We've got to set right, again, this country of laws. Now it's a country of money. It used to be a country of laws. We need to make sure this remains a country of laws. So we're all protected from the avarice that mocks our Constitution and drains the blood and treasure of our country and demeans us all. We've got to do this now. So when people say we can't, Trump's ascending, whatever, this is the time we have to do it now. So messaging, marketing, all of that, we can do it. We've got to do it now.
It sounds like you're talking about another truth campaign and
I'm
activism.
open.
Well, I mean, that is
Yeah.
what helped to turn the tides with the tobacco industry. I mean, those commercials were everywhere, and you do see people taking it more seriously. You do see people looking at some of the research around alcohol and deciding, you know what, maybe not. I don't really need that. So I appreciate you saying that.
Yeah. The anti-tobacco was successful because they turned the tobacco customers into the tobacco victims, which is exactly what they were. They were tricked by that, by the tobacco companies. We all remember, then Representative Congressman Ron Wyden, now Senator Ron Wyden in Oregon, talking to every single one of the tobacco chiefs, and they were saying, I don't believe tobacco is addictive, when they knew it was. And we could say the same thing. You don't see the NRA or the National Sports Shooting Foundation putting out things saying, things like, hey, we know that guns make movement safer, because they know they don't. They know they don't.
They don't.
Otherwise, they'd be putting on every bumper sticker in the town, right? It's not true. So yes, I'm all for a campaign, whatever we can do. Yes.
Thank you.
Thank
Dr.
you.
Joseph. Dr. Joseph, what are some things that you want participants to walk away with from today's webinar?
The first thing is, in addition to how Penny very eloquently outlined this, it's to remember that we do actually have a history of being able to solve problems, and to not get overwhelmed when you look at yourself as an individual, which all of us are. One, there's a history of individuals having a great impact, and David Hogg, who was at Parkland at the high school, I think is a wonderful example of that. So you have someone who, no matter what happens, and even as recently as a couple of days ago, has come out and said, yeah, we weren't happy with the results of the last election, but we're not giving up. That is really the attitude that we have to take. That is the attitude that you can argue with me about whether or not civil rights has been a success or not, but I've been alive long enough to tell you that it has. So where did that start? That started with people who had the attitude that they're going to keep fighting, even if I don't see it help me right now, it's going to help my children. That's the attitude that my parents had, that my grandparents had as African Americans, that they would do things with the notion that I may not see a result right now, but I'm fighting for this because it will improve the lives of people that I don't even know. And that's what, and who does these things historically? It's kids. It's young people who are really on the front lines of so many of these huge transformative events that take place, not just in this country, but just historically around the world. So when you feel that there's no way for you to get involved, there is. And I think Penny put in the chat that she can provide you with some very specific resources. The thing that I would tell you that was told to me when I was a young physician, starting to figure out the same questions that I think a lot of you have, how can I, one person, do this, is to remember that you have a story. Someone in the public relations field said, you doctors, you have a story to tell. And some of that is going to be statistics, some of that is going to be facts and data, but a lot of the way that you might be able to influence someone is to tell your story. I would bet that the majority of people here on this call have some connection to firearm violence, whether it is knowing someone who has been a survivor or not a survivor, having heard about someone who was not a survivor, having been remembering how they felt when, if I think our audience is mostly people on college campuses. A few years ago, you all were in high school and remembering how it felt to hear about what happened at Parkland, to hear about what happened at Uvalde, and it's, how many examples can we give? It's very easy to get discouraged. It's very hard to keep fighting, but if there's any group of people in our country who have had a history of continuing the fight, even in the face of what looks like impossible odds, it's the young people in our country. It's not the people who are my age now, it's the young people. So tell your story is the first thing. Figure out what your story is, put it together, and then find a place to tell it. So I think what Penny can do that I used to be able to do, but really can't as easily now, is give you the place where you can tell your story. But there are setting up something on your campus, again, to look at your own community. Don't try to think too big. Start and think in terms of your own community and tell your story. tell people why you are concerned about this as a young person. That's where I think you start as an individual to get involved in this problem, in any of these large, complex, wicked problems, is really to start by how does it affect you and tell that story. Even if you don't have access to all the data, tell your story.
Thank you so much. I really appreciate everything that you all have been able to squeeze into just a little over an hour. And I want to get to some of our questions from some of our participants. The first question that we have is, what is the best way for young adult college-age persons to get involved with preventing gun violence? Now, I imagine, Dr. Joseph, your recommendation for people to start small and talk about what is the impact and tell their story is a big part of it. But are there some other recommendations that you would give?
So, and again, I'm going to speak very briefly because I think Penny probably has more up to date information. But so when I was in college, and I think it's true now with people I know who are in college, nearly every college campus that I'm familiar with does have some group that has a social activist bent. And I would start there. It may not be that they are working on they may not be working on firearm violence right now, but getting involved in those kinds of groups that are community activist related, that's a good place to start. If any of you are interested in medicine, yes, the pre-med groups on your campus, more and more, I think, are focusing on not just how do I pass bio, but also how can I be a social activist, a social justice person. But I would start on campus trying to find out what are the places, or what are the groups that are focusing on that. And then the other thing, it sounds really silly, but call your congressman. One of the first things I learned to do when I was 17, 18 years old is I was writing letters to Michael Barnes in Maryland about things I was upset about. And you'd actually be amazed that how if you make enough noise, they get back to you. And because they know at some point you're going to vote, at some point they know you're going to vote. So they don't want to have ignored you. Maybe you're not the NRA, but at some point you're going to vote. And if you keep on them about things, believe me, they get back to you. And they were doing this with me when I was 18 years old. They're still doing it with me when I'm 62. So yeah, I would say those are two ways to get started as an individual.
Thank you. One other thing that I would recommend, I think most college campuses, inclusive of community colleges, have counseling centers. There should be some sort of messaging on campus that talks about the dangers of firearm violence, especially for those who might be struggling with some trauma or an acute mental illness, or perhaps a traumatic life event that has just occurred. And I think it's okay for people to inquire with their counseling centers, like what their recommendations are. And they should not necessarily just be in the physical vicinity of that counseling center, but it should be more, as Penny has mentioned previously, more mass marketing about what are the safest ways to avoid coming in contact with a firearm, why it's important to have a level of safety with that, and to also market that the counseling center is here for people who might be struggling with traumatic events, a major life event, or any other mental health struggle. Anything that you would add to that, Penny?
So there's a bunch of links you can go to. You can go to, first of all, you're like, okay, well, what gun laws do we need to pass? Okay, you can go to the denveraccord.org. So it's denveraccord.org. I helped write this. Devin Hughes and I wrote this. And it's a comprehensive list of what we really need to do, laws, policies to pass to reduce gun violence. GVpedia.org. For people who need help, who are survivors, survivorsempower.org. I'm also with that organization. Newtown Action Alliance. I particularly want to talk about them because they are hosting a vigil today, a national vigil today in Washington, D.C. They hold this every year to honor all victims of gun violence. It's Newtown Excellence. It was started by a woman who lives in Newtown, Connecticut. Her neighbor was the killer at Sandy Hook. And so that vigil will be happening today. I urge people to take part in that. KeepGunsOffCampus.org. It's a great organization. Gun Violence Archive is where you can get a lot of information. States United to Prevent Gun Violence. That's where you can find state groups. But I know like Portland State University has an awesome program of people who are working on gun violence prevention. So, and people are welcome to email me. Just my private email is Pen Okamoto. It's PENOKAMOTO@gmail.com. People are very welcome to talk to me there. But Kim actually really nailed it when she said the first thing you want to do is you want to develop your story, why this matters to you. How do you do that? You write out the whole thing. Just write it all out, okay? And then you condense it and condense it and condense it. And ultimately, I mean, you can keep all of these. They're all good stories, okay? They're all good versions, but then you're going to bring it down to something that's just a couple minutes, and maybe even something what we call an elevator pitch. You can talk to somebody in the elevator why you're involved in this, but start out with the whole thing and then pare it down. And she's 100% right. That's the first thing you really need to do. But if you need help, there's so many organizations, there's so many people who are working on this, and there's been so much great stuff done. It's all out there. You can email me and I can help you get directed to the right person. And I realize sometimes I sound very negative about this, but I remind people when I started this in 1999, one of our goals for the Million Mile March was to have licensing. And I thought, oh, that's never going to happen in my lifetime. And then 22 years later, Oregon actually passed a licensing law for firearms. So it does happen. We are still waiting for it to go through the courts to be enacted, but it has been enacted. It has been enacted. So we're just waiting for it to be able to, the courts need to release it and let it go. And I think we're going to be doing that soon. So it does happen and people have done incredible work, but we need to do more. Final thing, before you get involved in an organization, make sure you know what their goals are. Are their goals to ban assault weapons? Maybe you want to do that. Maybe you don't want to do that. What are their goals? You need to know that. Finally, Giffords Law Center, the best,
Giffords
tops,
is great.
awesome. Yes. Thank you.
Yeah, Giffords is a great one. Everytown. I just call them Everytown. I can't remember the whole I'm blanking on the entire name, but Giffords is fantastic. The most important thing really is to not feel hopeless about this. It's hard when you are 18, 19, 20 years old. It's hard when you're 40. It's hard when you're 60. But it's really hard when you're, I think, a younger person to understand that, to have a long view, to have what we call a long view, but you have to have a long view. You have to be willing to fight because it is the right thing to do, not because you expect to see an immediate result. And again, I don't know how old Penny is. I've said how old I am. I'm in my 60s. There are things that I didn't expect to happen when I was in my 20s that have happened. Let's be on a large scale. I never thought I would live to see an African American become president of the United States. I assumed that would not happen in my lifetime. But we fight for these things because I can remember Shirley Chisholm. She was my girl in 1972. You have to have a long view and you have to hold on to that hope that you can change things, even if you don't see it right away. You have to fight because it's the right thing to do.
Thank you so much for that. I think we have time for maybe one more question. Um, I think this is a very interesting one and more acute. While waiting on laws to be changed, many of our youth are not purchasing these guns legally. How do we increase parents' guardian awareness and get them active in reducing access and reporting the illegal guns youth may be in possession of? Penny, would you like to start?
Sure. So if I understand, basically they're trying to figure out how to prevent kids from getting guns illegally. Is that really the question? Okay, yeah.
Yes.
So and that's really about holding gun owners responsible. And one of the things, the problems that we face here is that people people get overwhelmed by a problem, or they're like, nothing happened. My guns are okay. Nobody's gonna take my gun. That's just not what happens. Most of the overwhelming majority of people who are school shooters get their guns from home or from a friend's home. And so we can do a lot of campaigns about where's your gun? This is you on a gun. Maybe you're like hunting or something like that. But this is your daughter, with a gun, with your gun. Maybe she's considering suicide. This is your son's friend, with your gun, who has now taken your gun and is using it criminally. Okay. So it's getting gun owners to realize that they do have a great responsibility to the public at large. Okay. Whether they're carrying firearms concealed, carrying firearms openly, whether they're carrying firearms in their car. So many people think that cars are gun safes. They're not. Okay. So really educating them on, if you're going to have a firearm, it's your responsibility. But the other thing too is holding responsible gun owners whose firearms are being used by anyone who shouldn't be having a firearm, but particularly kids and teens, holding them criminally liable. And you saw that happen in the Oxford high school shooting. And that was a really egregious case, but pretty much anyone who is allowing access to their firearms with the assumption like, oh no, my kids will be fine, needs to be held criminally liable. And unfortunately, studies show that that's the only way to get people to lock up their firearms. Daniel Webster actually did some great work on that at Johns Hopkins. We can take a look at that. And then Emma Hamilton actually also did some great work on that. She's in Texas.
Thanks so much for that response, Penny.
Thank you.
Anything to add? Yes. Anything to add, Kim?
I think that it's very hard to follow that. I mean, I think that was laid out very well. No, I don't have anything to add.
Okay. We might have time for one more question. How would you recommend specifically aiming efforts at young people, mostly young men, who are involved in gangs and/or illegal drug sales and have firearms and are killed? Dr. Joseph, would you like to start?
Sure. So I think one of the things when we were talking about misinformation, for example, there is a lot of misinformation about the involvement of young men in gangs in our country. I'm not saying that, there's a lot of misinformation that young men become involved in gangs out of a sense that it's cool. That is certainly true, but I think we neglect the economic imperatives that often drive people to become involved in these types of enterprises, and the intimidation, going back to what Penny said, that if you don't become involved in a particular organization, that you and your family now become at risk if you're not involved. The other piece of misinformation, though, is that a lot of things that are ascribed to gang violence have more to do with interpersonal conflict than they do with the business aspect of the gang functioning. So it's, you disrespected me. It's what used to be, with your kids going, he's on my side of the car. I mean, it sounds silly, but a lot of it really is about interpersonal respect issues and not really anything to do with the economic function of the gang selling drugs or selling anything else. So I think that one of the ways that we need to approach that is, one, to make sure that we're being accurate. I mean, when I was in practice, a lot of things that were ascribed to gang violence did not have anything to do with gang violence. So that's one thing. We need to clean up the information and make sure it's accurate. For young people who either feel forced to or choose to become involved with these organizations, I do think that this hospital-based violence intervention concept, ceasefire, grew out of or our HBIPs grew out of ceasefire in some ways, but this sort of providing wraparound services to say to somebody who has been involved with firearm violence to say, okay, I'm going to deal with you individually and not just apply some blanket solution. I'm going to deal with you individually and I'm going to find out what's your story? Why are you where you are? And how do we help you get somewhere else? Again, that's very labor intensive, it's very expensive, but it's also quite effective. It's what we would do for someone who has diabetes. It's what we would do for someone who has high blood pressure. We would say, okay, I'm looking at you, Mr. Jones, and this is the medical regimen I'm going to put you on. Well, okay, I'm looking at you, Mr. Jones, young person involved in a gang. Here are the things that we need to do in terms of addressing any involvement you have with law enforcement, addressing what your housing issues are, why it is you became involved with a gang. It's unpopular to promote the medical model, but this is in some ways that aspect of the medical model and personalizing care is appropriate. And I think that's part of what needs to happen. I think that's one of the ways that hospital-based and hospital-linked violence intervention programs around the country are having success because they are in fact tailoring their approaches to those individuals. It's precision medicine, if you want to go in that direction. So I think that's my bias at this point. I think it does have to be more of a precision tailored approach to the individual. I don't think you can apply blanket solutions to these young men because they don't all get involved with gangs for the same reasons. I do think you have to treat it almost as though it is a medical problem.
Right. I would like to address something I saw in the chat very quickly because I know we're short on time. So someone had talked about access to illegal drugs, and then access to firearms. So one of the things that we can do is actually make sure that federally licensed firearms dealers are actually also licensed by the state. And then once you're licensed by the state, states can actually impose a lot of rules and regulations that the federally licensed firearms don't have. For example, we've all been into a pharmacy, okay? In your pharmacy, you can't just go to the pharmacist and say, hey, you know what? I don't have a prescription for this drug. Can you give me, can you sell it to me anyway? And the pharmacist says, yeah, meet me around back. That doesn't happen. Or if it does, that pharmacist is going to be in trouble, right? Okay. We don't have that kind of thing for federally licensed firearms dealers, but we can do that for state. So we can set that up more like we have for pharmacies, or like in Oregon, how we have for shops that sell cannabis. Okay, so we have digitized records. Digitized. Federally licensed firearms dealers don't have digitized records. The ATF is not digitized. The ATF is not digitized in gun records. Anyway, okay, make sure they're digitized, make sure they have cameras everywhere, make sure they have just all those other things. So yes, there is a way that we can do that, and the states need to do it because the feds aren't going to.
Thank you so much. I know that everyone who was here today got a crash course in understanding this wicked problem of gun violence in the United States and the impact on young people. And I hope that everyone was able to walk away with more clarity about how to think about this particular wicked problem, not only through the theory of wicked problems, but also through the major concepts and particular root causes that were mentioned by Penny and Kim. I also encourage everyone to take a look at the different links that have been placed in the chat by Nicole. Some of these things were referenced by our panelists today and can give you even more information as you continue to think about this problem and follow along this webinar series. I want to take this time in our last minute to thank Kim Joseph and Penny Akamoto for joining us today and giving us such a wonderful discussion and answering our questions to help get us started and kick off this conversation about youth and gun violence in the United States. And I look forward to continuing this topic in this webinar series moving forward in 2025. Anything that you want to add, Nicole, before we close out?
The last thing that I would just add is that we're going to put some links in the chat that can help you find the registration for the other webinars that are going to be starting in January of 2025, which are going to help us continue to think about this by looking at higher education and how our community engaged scholarship can be a part of it. So community engaged research, community engaged teaching and learning, student-led civic engagement. There was a lot of questions about students, and so that'll be covered in a future webinar, and through anchor strategy and community partnerships. And as always, we're looking for you all to add to this conversation. So we know that this is a webinar type presentation, but following this, there'll be more interactive. And so we want you to be a part of that. We've also created a form for you to share your expertise with us, whether you want to think about being a panelist or you have other resources. I'm also putting that in the chat as well. I think
I
Dr.
have my
Joseph has
hand
one
raised.
quick
Yes,
thing, and then
well,
we'll be done.
only because there was a message in the Q&A about people who have experienced losses. And the first thing is, if you that happens a lot when you start talking about subjects like this, and make sure that you are taking care of yourself, whether that is getting professional help or if you have a support system that can support you, that goes a long way. And this is sounds a bit mercenary, but those losses are part of your story. That's part of the story you tell.
Thank
I would
you.
like to add, there's no other cause of death that makes the people who are the survivors come and beg for change. You don't do that for cancers. You don't. Anyway, sorry. Anyway, I just want to thank everyone for doing this, and thank you so much for making this one of your wicked problems and featuring it. I am so grateful. Thank you.
Yes, thank you all for attending and for
Thank
your
you.
questions. They were wonderful questions.
Excellent questions.
Thank you so much. And thank you so much, Nicole, for handling our logistics for today. And we look forward to continuing this. And I see a link in the chat, survivorsempowered.org, for anyone who is looking to talk about their story of loss or their own personal experience.
Thanks,
Thank you,
everyone.
everyone. Take
Thank
care.
you.
Thank you.